The goal of our research is try to prevent drug and noise-induced hearing loss. Probably noise is the cause for 50% of the hearing problems in industrialized countries like America. You have that basically noise can cause two different kind of effects on the auditory system. If you have some very high intensity noise, short duration, like a shotgun for instance, then it can tear apart, rip apart your auditory organ and induce complete deafness, sudden deafness immediately. The biggest problem is with noise-induced hearing loss. That is a cumulative effect of noise that is not so high intensity. This noise can kill some sensory cells in the inner ear. It's not a big problem usually once, if you have 10 cells, 15 cells that are killed. However, if you repeat 10 more cells next week, other next month, and the next year, and the next year, in 10 or 20 years, you are deaf. There are different kinds of drugs that are ototoxic. Probably the most important for the patients are some kind of antibiotics, the aminoglycoside antibiotics. This is typical antibiotics like gentamicin, streptomycin, very useful drugs for fighting bacterial infections. However, the negative side effect of these drugs is the ototoxicity. Many times the physicians have no other option. They cannot avoid using these aminoglycoside antibiotics because the risk of not using them is a risk for the life of the patients. We don't know yet how many of these ototoxic drugs work. We know that they kill the sensory cells. In particular, there is one target. The name is outer hair cells. It's a special sensory cell in the inner ear that are the target for these drugs. One of the mysteries is that why ototoxic drugs only affect these cells and no other cells in the organ of Cori. Currently, we are looking for some substances. For instance, we are working with one micronutrient, L-carnitine, trying to prove that this substance is able to prevent the negative side effects of aminoglycoside antibiotics. If we can discover one substance that is really effective and is safe for humans, that could be a huge advance.